Hi, everyone. So excited to be here today. Give me 1 second. I'm going to share my screen. While I'm doing this, I see that we have a lot of participants rolling in. Thank you so much for being here today. This is a live interactive masterclass. So what I ask of you is just go ahead into the chat and type in your name and where you're from, just so we can get to know each other a little bit. We really appreciate all of you being here. There we go. Okay, I'm almost set. I see lots of guests pouring in. So again, if you didn't hear me the first time, if you're just now coming in, just type in the chat your name, where you're from. I'd love to get to know you, where you're from. There we go. And now I'm going to share my screen. We are ready to kick this off. So right off the bat, to assuage any concerns about the replay, that's always a question that I get. Yes, we will have a replay coming to all of you. It'll be emailed to you within 24 hours. Stick around, however, we have a special gift we're offering you towards the end. There's going to be a live Q&A session with both of our expert guest speakers, Dr. Cory and Dr. Summer. We don't want you to miss this hugely insightful and practical masterclass on matching symptoms to Lyme and co-infections and overcoming biofilm barriers. Hi, everybody. Let's get rolling. My name is Kelsey, and I'm Zenmen Health's Chief Operations Strategist. I'll be leading today's session, Matching Symptoms to Lyme and Co-Infections and Overcoming Biofilm Barriers. Along with me, you'll soon be meeting our expert guest speakers, Dr. Cory Tichauer and Dr. Summer DelSignore. Once I read to you a summary of their resume, you're going to know why this is one of the most helpful masterclasses for you. Out of curiosity, to get a sense of this audience, so let me know who you're here for. Type a 1 in the chat if you're here to get info for yourself that you might be battling Lyme or its co-infections. Type a 2 in the chat if you're here for someone you know, like a friend or a family member, or maybe your child if you're a parent. Type a 3 in the chat if you're a practitioner or a health professional. Type a 4 in the chat if you're here for a child to get information on pediatric Lyme. So that helps me get a sense of who the audience is, how we can sort of navigate this masterclass and make sure that we make it the most for all of you. And so with respect to what you've brought with you here today, our goal is to equip you with a clear symptom matching roadmap for ways you can treat Lyme, Babesia, and Bartonella, even their most stubborn forms, while avoiding Herx overload and treatment burnout. Just want to take a peek at the Zoom and see how y'all are doing. Hold on. There's the chat. Okay, so Audra, thank you so much for sharing. She's here for someone she knows. She's here for a child. Thank you. Dr. Vale, thanks. Sounds like a professional. Dr. Taylor, thank you so much for being here. Audra, we've got people from Princeton, Orlando, Eugene, Michigan. Oh, so glad that you're here. We really appreciate you. So let's set out some promises, some of the goals that we have working together. I like starting these live masterclasses by setting expectations, and this can serve as our outline for today. Our promise is to help you break down how to recognize Lyme, Babesia, Bartonella, even in their stealthiest forms. You'll understand how these infections show up beyond the standard textbook symptoms so you can catch them even when labs don't. We'll show you how you can finally make progress on chronic fatigue, anxiety, brain fog without triggering intense Herxheimer reactions. You'll learn strategies that support detox pathways, lower inflammation, and help the body heal with less pushback. Woven throughout this presentation, you'll gain expert, guidance on how to safely and effectively treat Lyme disease in children. Our guest expert, Summer DelSignore, is a renowned pediatric Lyme specialist. She'll be sharing real case studies and insights tailored specifically for the littlest among us. Finally, we'll cover how to strategically combine herbal protocols that target those infections in their biofilm and cyst forms, a key step in helping the body fully clear persistent pathogens. So before we dive in, a quick reminder about the Lyme load decoder activity. So many of you might have gotten this. It was on the confirmation page when you register. There was a couple email reminders. It's a super short 10-question tool from your pre-work activity designed to help match your symptoms to a personalized starting point in the Zenmen Health Protocol. If you haven't taken it yet, no stress. We can drop the link here, as well as include it in the replay email tomorrow. It's a little extra incentive for you is stay with us until the end of the masterclass and you'll receive a special gift to support you in your next step forward. If you've already completed the decoder, great. Keep it handy so that way we can address it later on in the presentation. And just to clarify, this tool isn't just for those dealing with chronic Lyme. It's also a simple, fast way to guide you toward prevention and early support if you've had a tick bite or want to stay ahead of symptoms. Now, the topic drew you in for a reason. Audience members who show up live for an event are often the ones most motivated to seek information and start turning the wheels of change. We're not here to give you a magic bullet solution. So if you're looking for like a gimmick or a quick fix, then this is not the session for you. In order to be successful in the long term, you'll need a strong sense of that inner honesty and consistency within yourself to allow the information presented today to sink in. Be ready to dig in and do the necessary work. We can show you the way. We can't do it for you. Are you ready to participate? Have a little fun? Type yes in the chat if you're ready to get started. And remember, all the information provided here should not be used as medical advice, and you're strongly required or encouraged and required, I suppose, to consult with your healthcare provider before trying any medications or methods described today. Thanks, Audra. She's ready. Anyone else ready to get started? Well, if it's just Audra, that's okay. Thanks, Dr. Val. I appreciate it. So without further ado, I'm genuinely honored to introduce our guest speaker, Dr. Cory Tichauer, who's the Chief Scientific Officer at Zenmen Health. He's a leading naturopathic doctor with deep expertise in tick-borne illnesses, including Lyme disease. After earning his degree from Cornell University, Dr. Cory chose a more holistic path, focusing on naturopathic, patient-centered care over conventional practices. He now serves on the board of the International Lyme and Associated Disease Society and is widely recognized for his work with complex chronic Lyme cases. Today, he'll shed light on why Lyme is becoming more complicated, how our environment plays a role, and the real struggles patients face in today's medical system. Welcome, Dr. Cory. I think you might be on mute. Let me just unmute you. Let's see here.
I am unmuted. Great.
There we go.
Thank you so much. Yeah, it's really wonderful to be here. I'm excited to share everything with all of you out there and provide a little education and some insight onto how we can address things with testing and treatment and track progress. So
we so look forward to it. Yeah, thank you so much for being here. So my team and I at Zenmen Health share the same passion as Dr. Cory in that we don't think there's enough evidence-based information available to our audience. Take a look at these two US maps here. This is a prime example of what I'm talking about. Dr. Cory is going to share how this is an illustration of the lack of information available to you, the rest of the general public in America. Basically, we're looking at a problem of underreporting that is hindering our chances of spreading greater awareness of Lyme disease. Dr. Cory, can you explain this a little further?
Yeah, so this map actually presents a lot of, it could present a lecture in of itself because it's based on the CDC criteria that's challenging, and it's called the two-tiered criteria for Lyme diagnosis, and it is composed of two parts. One is known as the ELISA, which is a general antibody screen that you need to be positive to before you can get a Western blot or an immunoblot, which is the follow-up test that's done where you're looking at immune reactivity to individual proteins based on IgM and IgG reactions. And the CDC also has specific criteria that need to be met in order to be positive on each of those, either 3 of these IgM bands or 5 of the IgG bands. And it belies the problem that not only do you have to have a positive ELISA to get the immunoblot, but in order to get a positive immunoblot, you have to have those criteria met as well, where some of those proteins are extraordinarily specific to Lyme, and many people would argue that, say, a positive 23 or 39 band would automatically show that you have Lyme. It also creates the scenario that Lyme itself has a lot of immune suppressing properties to it. So the ELISA test, that initial study, is typically going to be positive or commonly positive in the first, say, 30 to 60 days after bite, maybe as long as 6 months after that. And then you reach a chronic phase where you start to see this immune suppression and other aspects of the illness that no longer trigger that positive response. So on the map on the left, that CDC map, you see that areas where there's a lot more Lyme awareness, in particular in New England, people are getting tested more quickly. You're getting those positive diagnoses more quickly. And those maps, if we were to go back all the way to the 80s, we would see that there's really not a lot of change other than you're seeing a little bit of a growing footprint moving from that sort of concentric New England area. The Google Analytics map on the other side is going to be a little different because that map is reporting on a whole host of lab tests that are going to be considered recognizable. So those are going to be PCR tests. Those are going to be RNA fluoroscopy called a FISH test. Those are going to be based on just immunoblots in the absence of the ELISA studies. So a whole host of other things. And those Google Analytics are being reported not just based on CDC criteria, but on positive diagnoses that ultimately are submitted to the regional public health, the county public health, where they have to ultimately decide to submit to the CDC. And then, of course, the CDC decides whether they're going to use that data. So what you see in that map, there are 2 things. One is you see that there's an enormous amount of increase in reporting throughout the entire US, where it's not just on New England. And as a matter of fact, a lot of New England, you see kind of those blue areas where you're not seeing as much change. And then the second thing you'll see is that there's a lot of that sort of pink and light red color throughout the West Coast and through the Rocky Mountains, where you're seeing an increased number of cases as well. And what this really shows is that there's unfortunately a lot of denialism on the widespreadness of tick-borne illness throughout the United States. So when you encounter a provider who may say, you know, you couldn't possibly have caught Lyme, you're in Wyoming, or you're in New Mexico, or you're in Oregon, you know, these are the maps that show that that's really not true. Those concepts are very much antiquated, and with the migration of ticks and the movement, you know, from birds and other animals, like it's, you know, particularly in these last 20 years, it's nationwide at this point. So this really just is a good map to start off with to say that if you have concerns, regardless of where you live, it's valid.
Yeah. Yeah, absolutely. Thank you so much for sharing that. And I think it again points to the evidence that not enough of these conversations are happening. You mentioned doctors sometimes are dismissive because the data that they have is insufficient. It's not that they're bad doctors, it's just they don't know what they don't know. And so at the heart of what we're doing today and with our live master classes is to share this information so it's not a surprise. It helps validate the experience that so many people struggling with Lyme have gone through. And we've seen like what underreporting looks like when illustrated on that last slide. What about the cases that are going undiagnosed? Can you explain more on that, Dr. Cory?
Yeah, so this is a big part of the problem. And you know, there's a multi-factorial component to this, including you know, the presentation of Lyme in all of its different forms. But ultimately, there's still the idea that you need to have an EM, an erythema migrans, or bullseye rash in order to be considered positive for Lyme, or that you have to have this recollection of a tick bite. And when we look at all the data, we find that honestly, most people don't recall a tick bite. And this is an interesting commentary, and a lot of it can go down to, especially in the West Coast, the nymphs, because you can get bit by these little almost no-see-um ticks that are like the size of a poppy seed, and oftentimes are more likely to transmit illness because they're a little less competent. You could think of them as juveniles, and they feed more quickly, and they're more likely to regurgitate. And a lot of times people just scratch those off. They don't know, they feel something, they scratch it off. So what you find is that less than 30% of people even remember a tick bite, and that less than 30% of those people even have that classic bullseye rash presentation. And frankly, like when you see the rash in practice, it's almost never a bullseye. I mean, there are scenarios where it happens, but a lot of times it's just sort of this spreading, localized sort of focal rash that you'll get, where again, if you've had a camping experience that happened in, say, the prior 10 days or so, you want to really think, hey, this could be a Lyme scenario. And then, of course, what I talked about in the earlier slide, the standard two-tier testing method is missing up to 50% of cases, especially in the chronic Lyme scenario. It's really geared as an epidemiologic test where the CDC itself says this test is not intended to be solely diagnostic. It was actually intended to track the spread of Lyme throughout the country as an epidemiologic resource. But somewhere along the way, it became adopted as like, this is the way that we need to test, when that's just not true. So now we know that there's a lot better testing options. And again, that's a lecture in of itself, but we see there's, better indirect tests with immunoblots now, with recombinant proteins, with labs that are using wild strains, as well as the B31 strain. We're seeing T-cell based tests, which are also excellent indirect tests that can help us track, on treatment progression. And now we've got these really phenomenal direct studies where, I tell my patients oftentimes they're not arguable. When we see a positive RNA fluoroscopy where we're actually, creating radio-labeled antibodies to specific sequences of messenger or ribosomal RNA, we know that it's that organism because it's not going to bind to anything else. We also see, better and better PCR testing. There's what's known as digital PCRs now, where instead of like trying to amplify a little, one sample and look to see if you can find DNA, we have the capacity now, from a computer or AI, almost, I don't want to say AI, but digital way to basically split that sample into 10,000 or 100,000 samples and run PCRs on all of them. So we get way better testing through those things. And there's obviously more testing than that, but those are going to be some of the most recognized and things that should be thought about when we're trying to, diagnose things that are going to be better than that two-tiered study.
Absolutely. And I know there's a lot of interest. It's a hot topic talking about testing. We have that coming up later on as well. So don't give all the good stuff away just yet. So did you know that ticks are often called nature's dirty needle? Dr. Cory, can you walk us through why Borrelia, Bartonella, and Babesia are the top concerns when it comes to the mix of infections they can transmit in a single bite?
Yeah, so the reason ticks are considered nature's dirty needle is I think at one point it was looked at where they ran these sort of, again, broad PCR studies in various ticks, and they found there could be honestly up to several hundred different organisms mixing between, bacteria, protozoa, and viral infections within a tick. Of course, we can identify about 14 to 17 really concerning things. But the big three that we always talk about are what we call the three Bs: Borrelia, Bartonella, and Babesia. And the reason I really explain it as the big three is when we look at some of these other things, Rickettsia, Ehrlichia, Anaplasma, Mycoplasma, Chlamydia, a lot of the time, it's not to say they're not important to address, but when we look at treatments for that Borrelia, Bartonella, and Babesia, they're often going to overlap into some of those other things, right? So the Borrelia, Bartonella, and Babesia tend to be, in my opinion, the most challenging, the most recalcitrant, and the most important to identify early on as a way to understand the sort of terrain of how to treat someone and how to monitor therapy. And those those three organisms all require sort of different nuanced treatments that are not necessarily going to overlap, whether you're using prescription medications or you're using herbs. They're going to be a little different. Again, some of those other things still important, and it would be fun to talk more on mycoplasma and chlamydia pneumonia as well, but we're going to really focus on those three Bs today.
We are, yeah, that is the goal for today, to focus on what those three Bs are, what symptoms are, and then what sort of protocols you've designed to help intervene. So we're talking about each of these three Bs so you can get a clear understanding of these symptoms that come along with it. We want you to feel heard. We want you to feel validated, because so many who suffer from Lyme get dismissed by medical systems because their symptoms are unclear to them. So, Dr. Cory, let's get started with Borrelia or Lyme disease, for example.
Yeah, so I think it's important to highlight that last point when we start this lack of provider awareness is a huge part of this. And it's one of the reasons that I think ILADS, the International Lyme and Associated Diseases Society, is such a good organization. It's the premier scientific organization educating physicians and providing scientific validation for what we're talking about today. It's something that if all of you are, struggling with this provider denialism, I would recommend you go to ilads.org and look at some of those resources, bring that to your provider, because it can really help them to bridge the gap between what a patient's saying and what they can see as being scientific validation and evidence-based medicine. Because again, there is a lot of poor testing, there is a lot of geographic denialism, and there is a lot of misdiagnosis or diagnoses that are made more based on symptoms, and that's where we see Lyme as the great imitator. That was a term that was coined for syphilis at one point, and it's not surprising there's a lot of overlap because Borrelia is a spirochete as well, and we see this multi-systemic presentation for Borrelia that's very individualized in the person, based on their individual susceptibilities, genetic and other things, as well as probably the strains of Lyme that they're getting. So you get this sort of shifting between body systems, these different presentations, and that can be really confusing for providers who are really trying to label things based on symptoms, which often is a very Western medicine-based approach to things. Not to say there aren't people trying to get to root causes of things, but even if you think about some of these like autoimmune or rheumatologic diagnoses, they're really diagnoses of reactionalism, like something triggered that rheumatologic response, something triggered that autoimmune reaction. And so like ending with a biologic agent, an immunosuppressant, an anti-inflammatory is oftentimes not the end point. And we see a lot of people who will be taking those medications, but struggling to even function and often just barely managing their symptoms. And when the reason is that there's this, this fuel that's continually being poured on the fire by these infections. So we see a lot of mimicry between like these functional diagnoses like chronic fatigue syndrome, myalgic encephalitis, fibromyalgia, again, things like rheumatoid arthritis, lupus, inflammatory bowel diseases, neurologic conditions, all those autoimmune gamuts. The other thing is that we often miss the onset of Lyme because it shows up so vaguely. These sort of flu-like symptoms, it comes on gradually. Sometimes it doesn't generally show up for about 7 to 21 days following a bite. A lot of times people sort of forget that. And in today's world, like we're so inundated with things that we have to do and stresses in our lives that it's really easy to dismiss those 3 to 5 or 7 days of feeling just kind of run down and flu-like and headachy and achy, without recognizing, hey, I was camping like 2 weeks before. And then, people forget even further as they go a month, 2 months, 6 months down the line, and they kind of realize, wow, I've had this progression towards, chronicity of my problems, and I'm less and less functional.
Wow. Yeah, continue talking more about what these symptoms look like on a neurological, cognitive level.
Yeah, so again, this is really highlighting the multi sort of presentation, the diversity of presentations you see with Borrelia. When we do see neurologic involvement, it's often a later stage of the infection, 6 months or more. And we can see these sort of progressive features like numbness and tingling is one we can see, nerve pain. We know like Bell's palsy, for example, where you see a drooping on one side of the face. That actually used to be a CDC specific criteria for Borrelia. So I always tell people, if you know someone who came down with sudden Bell's palsy, it often is a reason to just start treatment for Lyme. Because there's, often, I mean, I don't want to say there's nothing to lose, but time is of the essence, and I've seen it resolve so many times. We see presyncope showing up, people feeling really lightheaded, getting dizzy, feeling imbalanced when they stand up, the feeling of that they're going to faint frequently. One of the more common things I hear is cognitive decline. Again, something that is one of those symptoms that people can't exactly put their finger on, but they know that they're struggling to have conversations, to recall things, to focus on their tasks, to be efficient at work. All of these sort of things that we take for granted, but really become more and more obvious for folks who are struggling with Lyme to, as part of their functional presentation. And that often includes things that, whether it's a chicken and an egg scenario, we get a lot of anxiety, we get depression, irritability, and even more potentially like serious things like psychosis. And that's probably all compounding. You get this scenario where you're starting to feel worse, you're starting to feel more fatigued, you're having, difficulty with memory, word finding, cognitive thought. Like it drives anxiety, like something's wrong. And then you get these situational depressions. We get a lot of, again, functional neurologic things, light, sound, touch sensitivity. You'll hear people having distorted or disturbed vision, where they go and they get their eyes examined, and the optometrist, ophthalmologist will say, everything looks fine. Like we don't really see any issues. And, again, the presentation in these scenarios, people will say, hey, it's odd because sometimes I've got like great vision, I can see really well. And then at other times, I'll really be struggling to see, like everything looks kind of blurred or everything looks distorted. So it's kind of this in and out presentation, again, highlighting the migratory nature, and the varying sort of severity of symptoms that we see through the life cycle of Borrelia itself.
Mhm. Yeah, and it goes on to, we'll continue. So tell us more about these features here, these symptoms, please.
Sure. So again, just kind of continuing on with the multifactorial nature of Lyme,
Mhm.
probably the most well-recognized symptom and the one that a lot of physicians focus on, is inflammatory arthritis, and migratory joint pain. And we do see a lot of migrating joint pain. You don't always see the inflammatory arthritis. It does happen, especially early on, but the idea that you have to have like giants, a lot of swelling in a joint or a lot of redness is not always true, but the migration of pain from a knee to a shoulder to an elbow over the course of days or weeks is actually very common. We see a lot of stiffness in joints, this sort of feeling of like everything doesn't move very well. You hear a lot of people talking about crepitus or cracking in their neck, when they're turning their heads or moving their neck in certain ways. You likewise get, along with that neck stiffness, headaches. Headaches are often very different between the different types of infections. And for Lyme, we often see what's called a nuchal headache, one that sort of starts at the base of the skull where the cervical spine meets the head, and it kind of like radiates up from the back and towards the front of the head. You see a lot of sleep disturbance. This is, something that's common to all of these infections, but again, it's one of those vague symptoms that is a real struggle for providers because it's like brain fog or fatigue, right? Like it's something where, you're saying to your doctor, I just don't feel rested anymore, or I'm waking up more often and I'm having anxiety. And then, you're getting these comments, well, maybe your anxiety is contributing to your sleep issues. So maybe we give you an anxiolytic or try and like calm you down, things like that. When in fact, the issue is like the neuroinflammation that's coming from this infection. Again, just like these like the more frank neurologic issues that we'll see later, 6 months or more, we can sometimes see cardiac involvement. Cardiac and Lyme are always going to be the two most severe presentations. And in cardiac presentations, you will see, racing heart, palpitations, feeling of like skipped beats and arrhythmias sometimes. And again, like there's a lot of reasons for cardiac symptoms, and it should never just be assumed that it's Lyme. It's the reason for always having a good medical workup when you're dealing with something like that.
Yeah, absolutely. So let's talk a
Right.
little bit about the cycles, the treatment challenges, because I think that gets at the heart of why this is such a tricky disease.
Yeah, so this also explains like the life cycle of Lyme is complex because it has these different morphologies that we'll talk about as well.
Mhm.
In addition to one reason why it can be harder to treat, if you think about like things like staph or strep, for example, we're talking about infections that multiply multiple times a day or sometimes even an hour. And if you think about the medications that are used, or even sometimes herbs in these cases to deal with those kinds of infections, they're based on susceptibility on their divisional cycle, right? They're more susceptible at certain points while they're reproducing or dividing. Well, Borrelia has a very, very slow life cycle. It multiplies roughly every 23 to 28 days. So it's, we talk about these sort of 4-week cycles that are often linked to big flares in people. And it also can account for where you're seeing these sort of migratory symptoms throughout the week or the month. It's also another reason why in women you'll often hear cycles really kind of syncing with their menstrual cycles and everything flaring really badly along with their menstrual cycle itself. Um, we see, again, a lot of profound fatigue, especially at that sort of 4-week cycle where everything hits. It's kind of this like, phenomenal. We hear people say, like, gosh, yeah, I'm struggling with all these other reasons, but, for 3 to 7 days out of the month, like I am just not functioning well, or I have to call in for work. And again, like, when we start treatment, initially you may see, we'll talk more about this, of course, when we get into the treatment side of things, but what a lot of you probably know about a Herxheimer or die-off reaction. And that's simply the idea that when you begin to treat this organism, like think of it this way, if you have like, I don't know, let's just randomly say a number like 1 million organisms, bacteria in your body, and you start to treat it herbally or pharmaceutically, now you have maybe 10 million pieces of organisms in your body, and so you get a lot of increased what is known as antigenic debris, and that increase in antigenic material drives a lot more immune recognition. You're also seeing a migration out of these biofilms, and so the body can react to it more, and so you see this initial inflammatory response. And honestly, there are a lot of protocols, whether it's, pharmaceutical or herbal, where you're using challenges, you're doing things intentionally to say, like there's no reason that this should make you worse initially. And it's sort of validating for a lot of things. We also
Mhm.
know it can help with indirect testing because, again, if we see an increased immune response, increased cytokine reactions, all of that, we also know we're probably getting increases in antibody recognition or T cell reactions. So those indirect studies are often going to be more likely to be positive following, again, call it 4 to 6 weeks or 4 to 8 weeks of treatment.
Mhm.
And again, because of this sort of slow life cycle, and again, this is not the only reason, but we know that if you stop treatment too soon and you don't get rid of everything, the organism will eventually show back up, and you often see relapses. It's one of the reasons there's so much controversy. I don't want to say the main reason, but controversy about post-treatment Lyme syndrome, because no one's right, no one's wrong. There are certainly a lot of post-treatment Lyme cases where the reason is because the organism's still there. People have been insufficiently treated. And then, of course, there's other scenarios where we're seeing these sort of runaway immune reactions that can sometimes happen in other people. And that's, a whole lecture in of itself on post-treatment Lyme.
Yeah, absolutely. And so we're going to pivot slightly right now because we're still talking about Borrelia, but I want to bring in Dr. Summer DelSignore. So, Dr. Summer is a nationally recognized pediatric specialist in Lyme disease and complex immune dysfunction. With over 20 years of clinical experience, she's dedicated to identifying and treating the root causes of tick-borne illnesses in children, including Lyme, PANS, PANDAS, and related autoimmune conditions. As the founder of Hudson Valley Integrative Health and the Summer Institute, Dr. Summer has developed a comprehensive research-based approach that combines integrative medicine with advanced diagnostics to deliver personalized care. She's a member of ILADS and MAPS. She brings a thoughtful, well-informed perspective to her work. Her care offers new hope to families navigating the challenges of chronic pediatric illness through informed, compassionate, and science-driven support. Thank you so much for being here today, Dr. Summer.
Hi, thank you for having me.
So, Dr. Summer, since Lyme can sometimes be just the tip of the iceberg, especially in kids, can you help us understand how these infections can trigger deeper immune dysfunction like autoimmune encephalopathy and why those symptoms are often missed?
Absolutely. So with classic Lyme, we're looking for what Cory has mentioned with EM rashes and fatigue and joint pain and things like that. And with children, there is a heightened vulnerability from the blood-brain barrier perspective. So certain pathogens can cross that blood-brain barrier and directly affect that central nervous system by attacking components of that brain. So it can disrupt myelin, which is the fat insulation that helps transmit signals smoothly. It can disturb synapses, which are sort of like your communication and processing centers. It triggers general inflammation and can also excite microglial. And microglial cells are not neurons in your brain, but they're sort of the immune cells of that brain. They kind of keep it happy and healthy. And what we see with a lot of kids is that from that direct impact from a tick-borne illness, that those microglial can be protective, but also harmful in certain ways. So what they're known to do is clear damaged cells, they clear debris and pathogens from the brain, and then they can promote brain tissue regeneration. But excessive activations of them can trigger neuroinflammation, and that's what we see in autoimmune encephalopathy. So AE, as we call it, from a tick-borne illness may result from a direct central nervous system infection, an immune-mediated kind of encephalopathy, vascular damage, metabolic disturbances, and then sort of a post-infectious glial dysfunction. So even after you kind of clear the infection, if it's acute, that you still have this residual dysfunction. So essentially, when a child is in this state, you see those symptoms of confusion and mood swing, sometimes seizures or staring episodes, movement disorders called chorea, tics, and other symptoms that can mimic autism or psychiatric symptoms. And, so essentially what's happening is you have this direct impact to the central nervous system from things like Borrelia, other tick-borne infections, because there's no rule that says you can just have one infection transmitted from a tick. So things like Bartonella, Rickettsia, Babesia, and then some encephalitis type viruses. And all of these can lead to sort of a microglial activation. So again, those immune cells in the brain get supercharged. It develops the cytokine storm where you have these inflammatory interleukins in there that are activating, trying to clear whatever breach to that blood-brain barrier. And then you get ongoing inflammation to further create more of this blood-brain barrier leak. So more pathogens can cross over. It's sort of this vicious cycle.
Wow.
So an example is you see in kids who can have more of a neuro-Lyme presentation where they may immediately go, from being super healthy, no issue, to developing a seizure disorder or a tic disorder or a neuropsych disorder. So that's typically what we see.
Oh,
If
wow.
you Yeah, absolutely. And, if we're just focused on the typical symptoms of Lyme, we're going to miss a lot. We're going to miss a lot of those potential infections and those captures to treat those infections that are triggering this sort of neuropsych presentation, from nowhere.
Mm. Well, I appreciate when we had these sort of background conversations before today. You came up with a lot of case studies, a lot of patients that you worked with, and I love that you're bringing that to our conversation today. And so I have on a screen right here one case where you worked through with a 14-year-old patient. Do you want to tell us more about what happened to that child, and give us the sort of the rundown on that case, please?
Absolutely. And I know we have some providers in the group, so I can get a little more techie with some of this too. So essentially, we had a 14-year-old present. She was bedbound, nonverbal, non-responsive, minimal motor function, hypertonic. She was having constant seizure activity. She had a G tube for nutrition and a urinary catheter. And again, this was a perfectly healthy child prior to this. Digging into her past medical history, at 11 years old, she received an MMR vaccination, and she developed subsequent headaches that persisted for a year afterwards. She had had no other exposures beyond 2 known tick bites prior to that vaccine, and both of those were treated with 21 to 28 days of antibiotics. She didn't seem to develop any symptom at that time. She contracted COVID in 2020, which this could be a whole different discussion on another day, with rapidly progressive loss of fine and gross motor skill and then severe cognitive decline. She was followed by multiple providers. Her PCP and neurologist diagnosed her with autoimmune encephalopathy. They started her on oral cephalosporins and low-dose IVIG. Her symptoms at that time seemed to improve to baseline, but would regress like every 3 weeks after receiving that IVIG. As those antibodies sort of dwindled in her body, she would regress back to those symptoms. After about 4 months of IVIG, the providers stopped the treatment. That patient regressed and she worsened to a bedbound state. This is where I picked her up. So we did some diagnostic work, and while we were waiting for diagnostics, acutely restarted that IVIG, knowing that it had helped previously, but started her at 70 grams every 2 weeks following, and this is following the Toronto protocol. So because many people raise the flag and say, wait a minute, that's too much. In this state, no, and you do it for a short period of time to kind of regain the function, and then you space it out to the every 4 weeks to 2 grams per kilogram. We also initiated some plasmapheresis every other week, and then by that time had lab results coming back to show me that she had IgG and IgM positive Borrelia burgdorferi bands. She had bands 18, 30, 39, 141. Beyond that, she had different strains of Borrelia. She had Borrelia afzelii, Guarini, Spelmani, and Hermsii. In addition to that, we had anaplasma antibodies, and then we had IgG antibodies to strep and some viruses, CMV, EBV, parvovirus, toxoplasma, HSV1 and 2. Previously, labs had actually shown some low-level Babesia species, but nothing beyond that. Further investigated with diagnostics and with a neurozoomer, which is looking at autoantibodies in the brain specifically. And she had several. She had anti-amyloid beta, dopamine receptor, neurophation, EBV strep, and then acetylcholine receptors. And essentially, this test isn't looking for direct infection. It's looking for an autoimmune response to an infection or a toxin. So acute treatment initiated methylene blue, Mepron, IV doxycycline, IV azithro, IV rifampin, and then herbal drops via her G tube because she wasn't taking anything by mouth. So we added Hutania, Artemisia, Cryptolepis, Japanese knotweed, black walnut hulls, sarsaparilla, Chinese skullcap, cordyceps. I was throwing everything at her essentially to kind of get her back on track. And then certainly probiotics and detoxers and things to help her clear everything. So 4 months after initially seeing her, she was up to a wheelchair out of the bed. She did have some weight-bearing capabilities. She was alert and oriented. The G tube was still there for meds and things, but she started to tolerate some foods by mouth. Her executive functioning and conversational verbalization started to return. Treatment modifications after that initial 4-month follow-up was to keep pushing. So we started with high doses of IV vitamin C. It was about 100 grams a day. I did for about 4 days a week. And then we would then recover her with Myers cocktails and glutathione. She had biweekly NAD injections to kind of help with detox and support her mitochondria. She continued to make these gains. We noted she had some increased anxiety and OCD that was debilitating. So it was sort of either a symptom that had always been there, or we had cleared so many other symptoms that these were now at the forefront. Psychiatric evaluation and treatments were not effective in helping her, so we did further testing. And we tested T-labs for Babesia oticali, which was positive. So then we continued that treatment for Babesia. She's still in treatment now, but that just kind of gives you a sense of, when we're looking for tick-borne, that you really need to be comprehensive and dig. Again, there's no rule that says there's only one infection, one one bacteria that can be transmitted from a tick. Patients could have multiple. And I suspect that COVID was sort of the litmus. I believe she had some of these infections on board prior, and they were just really low level. And being a kid, her immune system seemed to be managing it effectively. But that was sort of the catalyst that kind of led to where we are. Absolutely.
And it goes back to the point that this is nature's dirty needle, that there's no one diagnosis here, and the case shows how deeply tick-borne infections can affect a child's brain and their body, and it's so important to look beyond the surface symptoms to get to the real root of what's going on. I really appreciate you sharing that. Thank you so much, Dr. Summer. We're going to turn back to Dr. Cory, who will share more on our second of the 3 Bs, Bartonella. Take it away, Dr. Cory.
Great. Well, let me just first say what a great case study that was, Summer, and how relatable that is. And again, to echo what Kelsey said, that when we're dealing with these tick-borne illnesses, it's not just these infections, it's the inflammatory response and the cascade that occurs as a result of all of this. And it requires a lot of vigilance and oftentimes like ongoing testing, which again will be a really fun topic to have with everyone later. I also love that you brought the high dose IV vitamin C treatments into this protocol, because we've seen really great results with that as well. I know that's a little beyond the topic of today's masterclass, but it was something that we actually published on. So if you're ever interested, for those of you guys who are practitioners out there, you can Google my name and the word high dose vitamin C, and you can just see the protocols that we used. It can be really effective for sure. Anyway, moving on, Bartonella, the second of the Bs. Bartonella is another bacteria. It has different targets, different presentations than Lyme. In general, it tends to target the blood vessel linings, what's known as the endothelial layer of small vessels like your capillary beds, which causes a lot of these neurovascular symptoms because it's the interface between the blood vessels and the associated autonomic nerves. When we think of Bartonella as a symptom presentation, we often think of it as having symptoms that present in exaggerated or out of proportion ways to what we would expect. So that can be like people talking about horrible burning pain or stabbing headaches, or like imbalance or symptoms that, neuropsychiatric symptoms, things that are just like, it's almost when you hear it as a provider, like you think, wow, you're really emphasizing that because it really is presenting that way for them. We also know that Bartonella is one of the main and concerning drivers of neuropsychiatric symptoms in tick-borne illness, something that I know there's a lot of passionate advocates out there trying to get more testing done for mental health facilities and in mental health providers, because just as Summer explained earlier, you'll see these cases of people presenting with, severe anxiety, depression, or even psychoses that ultimately is being driven by these infections. And we could see a huge cost savings to the system, as well as resolution or near resolution of a lot of these problems for folks if they were actually going to get the proper diagnosis. Just as you would expect, we know that Bartonella is going to coexist with Lyme and or Babesia, and does complicate recovery a little bit. Bartonella is going to often, in addition to that endothelial layer, you'll see that it has these reproductive cycles inside of red blood cells. But unlike Babesia causing lysis or rupture of those red blood cells, Bartonella will sort of like have these reproductive cycles within the cell until the red blood cell itself naturally breaks down, and then you'll see this release. So again, it's one of the reasons that we'll have difficulty with treating, and we need to keep treating for extended periods of time, because It's in, it has these life cycles, it has these different morphologies, and it presents in these sort of harder to access or immune privileged sites of the body.
Hmm. Yeah, we'll continue on and talk about the neurologic, neuromotor symptoms.
Yeah, so again, sort of like illustrating what I said earlier about these exaggerated symptoms, we get a lot of neurologic features. So sharp stabbing pains, burning pains. I've heard people talk about feeling of like water dripping down their bodies almost. Ice pick headaches, unlike that nuchal headache you hear from Lyme, people will often talk about these very like specific, often temporal region on the sides of the head, kind of stabbing headaches. You get regional numbness. So, in Lyme, again, you often get these sort of peripheral neuropathies that, show up in hands and feet and kind of eventually can migrate more proximally. But in Bartonella, you'll often hear about like regional areas of numbness. Like, I've got this spot where it's just numb. I don't have a lot of feeling here or here. You can certainly see like seizure-like episodes. Again, these sort of disassociations where people will say they kind of have no memory, or or you'll hear parents or partners of people saying, they just kind of like aren't there for like, 30 seconds or something like that. And they may not have memories of that. You get neuromotor signs, a lot of twitching in the body, muscle twitching, resting tremors, the idea that you're going to kind of see um, not necessarily an intention tremor, but a tremor that's just kind of like low level and often flares with people not having enough sleep or stress. Slurred speech or feelings of being very imbalanced is common. And as you might expect with it being on that neurovascular endothelial layer, you're going to get a lot of associated autonomic dysfunction. POTS is common. When people stand up, their hearts race, they feel lightheaded. Vascular inflammation that can show up as like things like temporal arteritis or just low grade vasculitis through the body. So again, it's when you hear these neurovascular things, think Bartonella.
Absolutely. Let's continue talk about the musculoskeletal skin systemic signs.
Yeah, so just like in Lyme, you hear about the migrating joint pain and large joints. For Bartonella, one of the most specific symptoms you'll hear in someone who doesn't have like a history of plantar fasciitis is pain on the soles of their feet and on tendon insertions. So unlike Borrelia, where you see infection inside of joints, Bartonella tends to affect more the insertions where tendons and ligaments actually join onto bone. And so you get these sort of periarticular presentations where you get pain surrounding the joint, which, feels like joint pain. But a lot of times when you palpate or you feel it, it's like those insertion points, not actually inside of the joint. Lymph node swelling is, again, one of the more especially acute presentations of Bartonella, but you do see it chronically. Often regionally as well, meaning you'll see chronic cervical nodes or inguinal nodes in the groin. Sometimes you'll see nodes in areas that you wouldn't expect necessarily, like on the back or on the forearms where you'll have some lymph nodes, but it's uncommon. And you see these sort of like subcutaneous nodules. People will have gastrointestinal symptoms, probably again neurovascular, because we're seeing a lot of that interface, and there's a lot of blood flow into the digestive tract, and the autonomic nervous system is so extensive in the enteric system. So you'll see abdominal pain, you'll see nausea, you hear people having poor appetite. Similarly, symptoms with the bladder, increased urgency with no signs of urinary tract infection. You hear this interstitial cystitis diagnosis coming out a lot of times. Heat intolerance, sweating for a lot of people. And then again, one of the more pathognomonic signs of Bartonella are going to be these red linear, what are known as stria rashes that look like stretch marks, but they don't typically follow skin lines, and they're not associated with sudden weight gain or loss. A lot of, especially women, will talk about, oh yeah, I've got, stretch marks on the sides of my abdomen from pregnancies and things like that. But a lot of times these stretch marks are different. They're going to be like on the back, like on the spine, sometimes on the shoulders, or on the shoulder blades, or even on the outer thighs, areas that you're not going to generally see stretch marks that are typically, that are easily explainable.
Yeah, but it's an example of how some symptoms just get completely overlooked or dismissed as a part of the changing body, of aging, of weight gain, maybe having a baby. And you accumulate, you put all these pieces together, and you start to see the greater picture here. And I love how earlier you pointed out the psychiatric presentation of these diseases are very often dismissed as something not even related to Bartonella or the others. So continue, talk more about this for us.
Yeah, this is a big deal. And this is an area where a lot of providers are really trying to focus on educating the mental health community, because these sudden psychiatric, presentations can very easily be associated with Bartonella. I have multiple cases, some of which, are great and turned out well, and others resulted in delayed diagnosis and outcomes that could have probably been, avoided had they gotten an earlier diagnosis. We also see a lot of stratification between psychiatrists, say, who really are just, treatment focused with different mood stabilizing medications versus those that are like trying to understand the etiology, like you would see from the aiming clinics, for example. But with Bartonella, again, you get sudden onset symptoms, a lot of times like panic, anxiety. You can see this progression towards OCD-like behaviors. More severely, we see hallucinations, mania, schizophrenia. And again, one of the more common symptoms that I know in partners and husbands and wives always kind of joked about a little bit, this sort of idea of mood lability, that your mood can change on a dime, and rage episodes are one that is more common, the sort of easily like angered for almost no reason, again going back to that conversation about neurologic symptoms that seem exaggerated. Again, same idea with this. You see like provocation to reactions with very little provocation, right? So like it might just be something that shouldn't make someone get so upset or angry, but it does. And then, we see things like depersonalization, suicidal ideation, of course, and all of these more severe presentations. I always would recommend working in concert with a mental health provider or psychiatrist, because in these cases, a lot of times medications can help stabilize people until you can deal with that root cause. And then there's always a collaboration to come off of that and see people continuing to do well.
Absolutely. Yeah, thank you for sharing that. Here we have Dr. Summer. She's going to share another case study from her practice. This one is about a 16-year-old boy battling Bartonella. Dr. Summer, why don't you take it from here?
Got it. I love these case presentations, so thank
Me
you
too.
for yes. So we have a 16-year-old male who presented in 2021 with severe debilitating neuropathy to his extremities, severe anxiety, OCD, psychosis with hallucinations, and suicidal ideations. And again, perfectly healthy child, perfectly stable mentally prior. The patient had been evaluated by his primary care provider and multiple neurological providers out there with a psychiatric specialist who deemed his neuropathy idiopathic in nature. The patient had multiple inpatient psychiatric admissions and for threats of suicide. He was on high doses of gabapentin for the pain without relief. He was noted to have had exposure to Lyme in the past, and he was treated with short course antibiotic therapies, which had helped him for brief periods of time to reduce the psychiatric symptoms and reduce that neuropathic pain experience. But no one was connecting the dots that may be the causative agent. So initial testing showed positive Lyme immunoblots with both IgG and IgM bands for alpha protein C, A, and B, which are bands 23, 31, and 34. And these are pretty specific indicators of Lyme disease in many cases because you don't have a lot of cross-reaction with other bacteria microbes. Positive Bartonella henselae was IgG low, moderates, but he did have evidence of it. He had a negative fish test at the time, and Babesia, microti, and Ducani were negative. His viral panels were also positive for EBV and parvovirus, again, high-level IgG antibodies, so nothing that was showing crazy active at the time. Environmental testing was showing elevated levels of mold. And this, I know this focus is primarily Bartonella, but it just, again, illustrates the most often significant cases, bringing multiple pathogens with it, further kind of compound the severity of the illness. So the patient was placed on combination antibiotic therapy for Lyme and Bartonella with moderate improvements. Herbals were added to target biofilms, intracellular and cell wall forms of the bacteria with significant herxing experience. So he was on things like cinnamon, clove, oregano, cryptolepis, Alchornea, Chinese skullcap, Japanese knotweed, and garlic. He maintained a binding and detox protocol just to kind of remove the debris and also start chipping away at the mold. And then we also started some courses of IVIG and plasmapheresis, along with ozone therapy, MAH ozone, which is just a small amount of blood we take out. We heparinize it with saline and we inject it with the ozone and then infuse it back into the patient. So a very safe method from an ozone perspective. And then we also gave him SOT therapy for Bartonella and Borrelia burgdorferi. And SOT essentially is just a gene silencing therapy that sterilizes that bug to prevent it from replicating further. Supportive therapy for the neuropathy, we gave some IV Myers cocktails, IV NAD, oral alpha lipoic acid, and then methylated B vitamins daily, and then a couple of injections a few times a week. So this patient continued to make moderate gains. He regressed 2 years into the treatment after an additional tick bite, because again, you don't develop immunity from a tick bite initially. So he was retested with no notable new infections via Vibrant Wellness tick-borne panels and IGNX immunoblots, so we did both. But given the uptick in the severity of his neuropsych symptoms and development of rashes and striae, we further tested him via TLABs for both Babesia oticali and Bartonella henselae, both of which were positive. So we added a few more bugs to the mix that were showing very strong antibodies at that time. And on the slide from TLAB, quite a bit from there. So the patient was then initiated on elevated doses of his herbals. We added more biofilm busters, and I know Dr. Cory will get to that soon, but we added stevia, serrapeptase, nattokinase. We gave bismuth thiol compounds, and then initiated malonyl methylene blue with azithromycin pulsed, and we rotated with Tindamax, added additional Japanese knotweed, Chinese skullcap, Titania, and cryptolepis in higher doses. And then that patient started to show improvements again. So then we switched that protocol to a weekly dose of Ericoda, and the patient's tolerating that well, currently on it. He continued his ozone, he continued all of his IV nutrients and supports. He lives independently now in New York City. He's not having any suicidal thoughts, no intrusivity, no severe anxiety or depression. The neuropathic pain is resolved at about 85 to 90%. So still there, but tolerable. He's still healing. The OCD persists with low levels of anxiety, but he's completely functional. But this case is showing a that your symptomology was showing that Bartonella had the reins, even though he had other underlying viral illnesses, Babesia, Lyme. So it's just showing that you still have to treat all of those infections on board, but also listen to the body and prioritize the treatment based upon those symptom expressions.
Yeah, absolutely. And it just goes to show you when we're talking about a chronic illness, it's a long battle. And when you're equipped with the right team, the right people who are there to help you, it can make all the difference in the world. And it's so inspiring to hear that despite the long road and that he might not be, in the clear totally now, he's made such advancements and he can live a normal life. And that is 100% our goal for our audience and for everyone listening in today. So thank you so much for sharing this, Dr. Summer. Let's switch gears. So Dr. Cory, Bartonella can cause major neurological symptoms in kids. Babesia brings a whole different set of challenges. Can you walk us through why this red blood cell parasite is so often missed and how it complicates Lyme cases even further?
Absolutely. And I'll try and move through things a little bit faster. Just looking at the time and recognizing how much we're trying to cover
There's
still.
so much to talk about.
I know there really is, and it's
miss.
so fun to continue to get into the depths of all of this. And I again want to just say what a great case that was from Summer. and how relatable that is, and how important it is to know that while there's a lot of scenarios where herbal therapies are certainly able to fully treat people, there are a number of other cases that you're going to want to see a good Lyme literate provider like Dr. DelSignore or myself or someone else, where you're going to be able to not only use the herbs and focus on things that are going to help to restore health or treat things naturally, but also potentially involve pharmaceutical interventions, because there are scenarios where things like tefenoquine or Monolaurin or advanced diagnostics or other medications are important. And these combinations, this integrative approach, is sometimes going to be what it takes. And I firmly feel that bridging worlds where you're trying to work with a Western medical model as well as a natural protocol is often going to give you the best outcomes in the more complex cases. So Babesia, Babesia is a parasite. It's a protozoal parasite known as a piroplasm, sort of related to malaria. We call it malaria's evil cousin just because it's actually a lot harder to treat. It can lead to a lot of inflammation, localized tissue oxygenation, deoxygenation or hypoxia, and rupture of cells. It's often misdiagnosed or overlooked as well, but it often worsens Lyme symptoms. And in some of the most chronic or severe Lyme cases, Babesia is involved. There is a newer strain of Babesia that Dr. Summer highlighted, which is Babesia otocoili, and something that we use T-Labs to look for. It's a little harder to treat potentially because it's a little smaller even, but it highlights the fact that there are a lot of species. We know there's at least 14 different Babesia species, and we can really only test for about 3 of them right now, Microti, Dinkani, and now otocoili. So it is often overlooked. It's known for its cardiopulmonary, neurologic, and inflammatory symptoms. Of course, because it involves red cells, you would expect that it's going to involve, the respiratory and cardiovascular system. We'll see cycles that often sync up in concert with its life cycle. So even though it's constantly multiplying and dividing in different ways, you'll kind of get these congruency points that happen around every 3 to 4 days that sort of reflect its replication pattern. And that's often, when we see these big spikes or flares.
Mm-hmm.
Again, classic symptoms related to oxygen disruption. We'll often see fevers or fever-like illness. People will, not necessarily have fevers, but they'll feel feverish. And sometimes you'll hear people like, especially later on, they'll say, my normal temperature is not 98.6, it's 96.4, things like that. And we know that globally, the temperature in the body is actually moving down, probably, again, related to a lot of toxicants and other things that are affecting cellular metabolism. But, you might hear someone be like, 99 degrees or 98.9, like, and that might be a fever for someone who's running 96 often. Drenching night sweats is often a keynote symptom. You'll hear this sort of happening like you would expect in sort of that cyclical nature around every 3 days, around 2 to 3 times a week. For a lot of people, they'll get these like night sweats. Air hunger is a very specific symptom as well that you hear about. People can't explain it. It's not asthma. It's not a chronic cough. It's not a wheeze. It's a feeling that you're not getting enough oxygen. And you'll see it where people yawn a lot or they sigh a lot. But there's this clear, like, I feel like I need air. Headaches for Babesia, just like you heard of the different presentations, whether it's, nuchal and Lyme or stabbing ice pick headaches for Bartonella. For Babesia, it's a squeezing headache. It's a pressure headache. Often people report it as a band around their head. And again, like we said, Babesia often is more like an exaggerated Lyme in the terms of a fatigue. Fatigue is worse. It's more extreme. It's more persistent. Any exertion, you'll hear this like poor recovery, like, hey, I walked, half a mile and it, I had to take the rest of the day to recover, or you did something, you went to Disney World and took 2 days in bed afterwards to be able to function again. With Babesia, because of its oxygenating effects, you will often see more muscle pain than joint pain. And that's probably related again to energy production, aerobic versus anaerobic energy. So again, if you're not getting enough oxygen exchange, at a tissue level, you build up lactate, lactic acid, and everything kind of just feels achy.
Mhm. Yeah, we'll continue on and talk about the vascular, sensory, cognitive signs.
Sure. So again, just like we said, it's a lot of because it's in the blood vessels. So you can get little jaundice, sort of like, because again, you're getting ruptured red cells, and sometimes that just shows up as a little bit of a increase, in terms of bilirubin markers in your complete blood count. People will report easier bruising than normal. You'll see cherry angiomas, these little red spots that show up all over, and a lot of times they're on people's chests and trunks and backs. And when you'll say, oh yeah, I got like 30 more of those over the last year. As you would expect, again, with this vascular component, ringing in the ears, hearing loss, people will get chronic sore throats. They'll feel dull, like mentally dull is kind of a big symptom. Again, maybe it's related to poor oxygen perfusion in the brain, that cerebrovascular circulation is being affected. So cognitive slowing, dizziness, imbalance, racing heart, again, probably related to just trying to move oxygen through the body, but these are very common symptoms. In lab findings, you'll see those red blood cell breakdown markers like, bilirubin. You'll see, sometimes low red blood cell counts. You'll see increases in the mean corpuscular hemoglobin content, and reductions in or indications of hemolysis in those markers. And sometimes you'll see signs of hypercoagulation when you're looking at like fibrinogen activity or a thrombin antithrombin complex.
Thank you. Let's continue on. Talk about the mood, symptoms, other clinical cues.
Yeah, so for Babesia, anxiety is a big one. And again, that might be related to its oxygen component, but it's more of a generalized unexplained anxiety. It's chronic. You'll see, again, sometimes people developing OCD behaviors maybe around that anxiety and trying to like do things, get out of the house, go to work, go to the grocery store. You see symptoms, as we talked about, sort of cycling on these sort of 3 to 4 day rotations. And when you think of Lyme, and you might say that, but it seems more, again, stronger Lyme symptoms, more fatigue, more aching, more sleep disturbance. Babesia honestly might be involved, and it certainly, just like Bartonella, can make treatment more complex because you're dealing with a parasite at this point, a single-celled organism that is not a bacteria, so it requires differing herbs or differing medications.
Mhm. So let's pull Dr. Summer back in because all of us, we've seen firsthand how infections can be missed in kids. Dr. Summer, can you speak to the growing concern that some children diagnosed with autism may actually be dealing with undetected tick-borne infections like Lyme, especially when symptoms overlap so closely?
Absolutely. So just to kind of give a background on autism, it's a neurodevelopmental condition. There's multifactorial etiologies associated with it, and that can be including immune-mediated mechanisms. And emerging evidence is suggesting that infections like Borrelia may trigger that neuroinflammatory response and autoimmune response and contribute to those symptoms. What we're seeing in the research emerging is congenital transmission is highly likely in many cases. The research suggests that certain pathogens cross over the placenta, can reach the fetal central nervous system, and directly disrupt neuronal migration, myelination, synaptogenesis, so globally affecting the development process of the brain. And this is important because we see a lot of kids who were developmentally on task in the beginning, and from an insult, either from an infectious disease exposure, from a vaccine or something, and then you see this regression. So when you see that, typically something was already there that kind of triggered it. So we don't go from having a perfectly, developed brain to now having something, from a neurological perspective where there's misfiring and there's miscommunication. So certain examples of Borrelia burgdorferi, we know that it can localize to neuronal tissue, and disrupt the white matter there. And that has a lot to do with glial activation. So when you see an MRI on these kids, if you're concerned about it, you see these hyperintensities in those areas without known injury. Things like Bartonella can infect the neural endothelial or the glial cells. We see that in postmortem studies. We see it in animal studies. And again, we see those glial cells are not neuronal cells, just like the microglial, but they're responsible for maintaining the blood-brain barrier. They help us form myelin sheath around the axons. They provide structural support and chemical regulation all around them. So they're the helper cells, essentially, to support those neurons. Things like Babesia can cause microvascular damage, and this can reduce that oxygenation that Dr. Cory was speaking about. Secondarily to that, we get this sort of metabolic dysfunction, so issues with potassium and calcium voltage channel pathways, along with acidosis. So infections during pregnancy can cause the systemic maternal inflammation, and this alters that fetal brain development. And so essentially what you're doing at that time is priming those microglial. So when this baby's born, they're already primed, they're already in an inflammatory shift state. And then you can also get things like molecular mimicry, where those pathogens are now expressing antigens structurally similar to the neuronal proteins. It's a bit of a trickery. And this can generate this sort of cross-reactive antibody that can then target basal ganglia, dopamine receptors, tubulin, and this is what's triggering those neuropsych symptoms as OCD, the tics, the intrusivity, the repetitiveness, the a lot of the developmental components where kids can't transition, socialization is effective, all of those things. So I mean, what I see with Lyme is that there is that cross-link, not just with Lyme, but other tick-borne infections, and maybe not a direct infection of the baby. Maybe mom has it, and the child is just subject to the inflammation created as a result of it. So I could postulate these babies are already exposed to tick-borne or something else that primes that immune system before birth. And then when you have that exposure, you get sort of this violent reaction and dysfunction that immediately occurs.
That's an excellent segue to the next case study that we're presenting. We have a sweet little baby here, but when you met him, he was 3 years old. Is that correct?
He was 3 years old. Yes, yeah.
And so go ahead, tell us more about this.
Absolutely. So he already presented to me with level 3 autism spectrum disorder, OCD, motor tics, absent seizures. He was hypotonic. He had a lot of sensory dysfunction. And his past medical history, he was born at 36 weeks. He was small for his age. He was only 4 pounds, 6 ounces. It was an emergency C-section because mom developed HELLP syndrome, very common with women who have underlying Babesia and may not know it. He was in the NICU for several days with respiratory distress. Mom was positive for Lyme, Babesia, and Bartonella during her pregnancy and was actively being treated by a colleague of mine for the duration of that pregnancy. So at the time of birth, the patient's cord blood, his placenta, the umbilical cord, colostrum, foreskin, everything was tested. We sent that off to ILADS for testing. We looked for Lyme, we looked for Bartonella, Babesia, and Mycoplasma. All were negative at birth. And then we continued to test every 6 months to a year, was my understanding prior to seeing me, that he was retesting, all negative, but continued on with symptom. Immune markers, again, all normal. And this, again, could be another discussion for immune dysfunction with exposure. The only thing that we did find is that he had a positive MTHFR mutation, which has a lot to do with how you break down B vitamins and how you utilize them in the cells. So the patient presented with these clinical suspicions of the tick-borne infection. He was a colicky baby. He was difficult to breastfeed. He reacted to his mom's breast milk. He had chronic constipation and reflux. He had projectile vomiting and food intolerances. GI workups were negative. Everything looked good structurally with him. He had drenching night sweats. He had severe insomnia. He was unable to calm. He had leg tremors, staring episodes, all with normal EEGs. Anxiety and panic attacks, light sound sensitivity, you name it, the kid had it. So mom presents and we start treating based on those symptoms. So the initial treatment was to address a lot of the gut inflammation and knowing that there is that gut-brain connection from a neuroinflammatory perspective and an immune perspective. We gave him some methylcobalamin, some melatonin, L-theanine, and Epsom salt baths to help calm him down and get him to sleep. Then started based upon symptomology, tick-borne treatment, knowing that mom was positive, the child was presenting with symptoms of Babesia, essentially, and started it on clarithromycin, Bactrim, and then herbals, stevia, cinnamon, clove, oregano, garlic, Cryptolepis, Artemisia, Chinese skullcap, Japanese knotweed, and black walnut hull. And we noticed increased communication with 2 to 3 word sentences within just a month or two. Sensory improvements, he was trying new foods. He still had a lot of fears. He still had a lot of OCD anxiety. We didn't fix him yet, but we saw some really remarkable gains just from starting that treatment for clinical Babesia. His sweating increased, so he was having day and night sweats that had intensified, especially after taking his clarithromycin and Bactrim dosing. We added Mepron as well, and again noticed more sweats, but he had significant gains with socialization, personality, cognitive gains with words and more complex sentences. Interesting, he was off of his treatment for about 5 days. Parents were vacationing, they couldn't source it, they couldn't get to a pharmacy, and this was all herbals and medications, and the kids, and he regressed back and lost all words, lost all cognitive component. So again, cruising along, doing really well, and then contracted COVID in 2022. At that time, we initiated some additional support just to reduce the inflammation, some vitamin D, some glutathione, zinc, ivermectin, a few other things, and then some andrographis. Testing after COVID, just from previous case studies presented, I'm thinking, okay, what else did we stir up here from this COVID? It seems to be helpful in certain ways at addressing underlying, subclinical type infections. It kind of pushes them to the surface. So this child also presented with positive Babesia oticali, but his Lyme titers had improved. So we were seeing this sort of Babesia that was probably already there, that we couldn't necessarily test for, prior. This test is fairly new. And I think that certain things like the Lyme was sort of top of mind for the immune system. So we know that the immune system is kind of one-track mind. I joke about it in a cheeky way and say, hey, it's like a guy. It can only deal with what's in front of it at that time. And before it can see anything else that's in the immune system. And once you kind of clear that off the plate, then it can kind of scan and see what else may be there. So we initiated additional treatment for that Babesia oticali, understanding how it differs from Microti and Duconi. And we started a dapsone protocol with him. Very specific to weight, kids over the age of 4. We waited until he was 4 just to have the safety profile. And then also initiated things to support him while you're on things like dapsone with the leucovorin methylene blue. And what I found is that interestingly, we needed all hands on deck. We needed all of the herbals. We needed all the medications to really push this child through and really have those improvements. And after we initiated that dapsone protocol, we noticed within a month he was speaking full sentences, imaginative play, no sensory issues, tolerant of visual, tactile, and auditory stimulus, trying more foods, initiating conversations and socialization with peers. And the mom reported that at Thanksgiving that year, he sat down and he ate this massive plate of French fries and was like, Mom, I'm thankful for these French fries. They're so delicious. And so this is a kid who is tap dead center autism, nonverbal, not communicating, not interacting. To hear now he's having a plate of French fries at Thanksgiving.
It's
So
nothing short of a miracle. Wow.
one of my favorites.
It is, and he's such a sweet kid. Thank you so much for sharing all of these case studies. It really highlights it's not just talking about symptoms. We're not just putting words out on the table today. We're talking about real people. And I want to thank the audience for sticking around for this presentation. We really appreciate your investment of your time and your thought into this. We hope that you're walking away with some really useful information. We're going to switch gears to biofilms, but I just want to sort of get a pulse check of the audience here. So, quick show of hands, tap a one in the chat if biofilms is something that you're familiar with. So we've talked all about the three Bs. We're switching now to talk about biofilms. We're going to talk about morphology, and then we're going to finally get to the good stuff of like the solutions that we can at least share with you today. And so if you ever feel like you're doing the right things, you're treating the infections, you're supporting the detox, but you're still not getting better, you are not alone. So there might be this hidden barrier at play that most people have never heard of before, and these are biofilms. So while these numbers are coming in, I'm not sure. Let's see. Do we have someone coming in? We've got no one responding. That's okay. So can you help us, Dr. Cory? Let's talk about biofilms real quickly. What are they? Like, why are they such a critical piece to the healing puzzle, especially in chronic Lyme cases?
Yeah, so we know biofilms are ubiquitous in microbial communities, whether that's in like water systems or sewage things. Like we see it everywhere, but they exist within our body, and a lot of chronic infections. They're part of why their chronicity exists is because of their capacity to produce biofilms within the body. So biofilms are complex, but ultimately they're a combination of secretions from the organisms themselves, these allogenates, components of our clotting cascade known as fibrin. And then we often see a mineral component as well, especially in these Borrelia biofilms, to make this like protective shield known as an extracellular polymeric substance. And basically, these protect the bacteria from our immune systems and from medications or herbal therapies. So it's critical to help break these biofilms down as a means to ensure successful outcomes and to improve the efficacy of these antimicrobial medications or herbal therapies.
Here, we'll move on really quickly. All right, let's
Yeah.
talk about, and I put these images in. You tell me if I did my homework correctly, Dr. Cory. So we're going to talk about the
Yeah.
resistance a little bit. We'll talk about the immune system evasion. Go ahead, let's talk about this hidden barrier of biofilms.
Yeah, and again, I can go on and on. Obviously, you guys have probably gathered that just from the first part of this lecture. I'm trying to keep things moving along for you all so that we can get to the treatment side of things. But just as I said before, this is kind of an example. It is a good picture, Kelsey, of what a biofilm would look like. And again, it's this kind of like alginate sticky substance, fibrin that kind of creates rigidity or like framing in a house. And then the mineralization kind of like creating that sheetrock layer. But what we know is that within a biofilm, these organisms are about 10,000 times more resistant to antibiotics than they would be if they're just circulating through the body, where our own immune cells are capable of dealing with them. So even long courses of herbs and antibiotics can't reach or kill these bacteria. And this is a huge component of underlying the concept of chronic Lyme itself, and why we see such disparity between the standard CDC guideline of, again, depending on what you're looking at, 10 to 21 days of antibiotics versus what we may see in real life care, where we're needing 2 to 6 or longer months of treatments, whether that's strictly herbal, integrative, or pharmaceutical.
Mhm. Let's talk about immune system evasion a bit too.
Yeah, so just as you would expect within a biofilm, these communities are able to shield themselves. So our immune cells have trouble even seeing these organisms that are protected by this shielding. And we see this in cancer as well, this idea of creating this fibrin structure on top of the biofilm, because our fibrin is a part of our blood clotting cascade. So it's ultimately neutral to our immune systems. And so it can actually shield infection, for example, or potentially cancer from the recognition of our immune system and allow these organisms to grow and communicate with each other. And this is where we see this concept of quorum sensing. Quorum sensing is another well-known concept amongst polymicrobial communities, the idea that we may have more than one organism or a bunch of organisms living within a biofilm. And just like in a community of people, these organisms have ways of communicating with each other, and they are able to convey sort of what they've seen in their environment to develop or further enhance their own resistance methods. And this is just another aspect of why Lyme is difficult to treat, because they can upregulate efflux pumps to move waste out and to prevent things from getting in. It can allow them to communicate the idea of what things out there, like antibiotics, for example, or immune cells may be more able to identify them, so they'll change surface proteins. And I think that's our next slide, is on surface protein shifting. Maybe it's one after that. So yeah, when again, relapse and persistence, just as everyone would imagine from what I've just discussed, when you stop treatment, you've treated a lot of these free-floating organisms, and oftentimes you can know that you're at that point because people have gotten better, they're more stable, they're not getting further improvement with treatments. But when you stop treatment, again, depending on what organisms are involved, it may be a month or two, or even up to 6 months for Borrelia, more quickly for something like Bartonella. But you often will see a relapse of symptoms as these organisms leave the biofilms and begin to reactivate the immune response. And so biofilm therapy ultimately just highlights why we want to make sure we're addressing it in chronic cases.
Yeah, absolutely. So it's not just addressing the underlying condition, but it's the biofilm as well. And on top of that, we have symptoms that come back no matter what treatments you're trying. So maybe things get better for a while and then a flare up again. Like what's going on there, Dr. Cory?
Yeah, so this is another big topic that we've seen a lot of emerging research, a lot of publications in the last 5-10 years. The idea that bacteria themselves have morphologies, they're capable of moving into different forms, whether they're trying to create tissue invasion in Lyme, like a spirochete, or whether they're inside of these biofilms, where they're in these like L forms, where they're not trying to move, they're just trying to sort of reproduce and communicate with each other. Or we get what is known as cystic or persister forms of Lyme, where ultimately the bacteria enfold their proteins that are used for immune recognition. You see very limited capacity for the immune cells to recognize that single protein associated with persister Lyme. And they basically go into a state of metabolic senescence, or where they're just metabolic inactivity. So they're able to just kind of like slow down their life cycles and just kind of hang out. And it's been one of the main topics of how to effectively eliminate Lyme. And there are different herbs that certainly are more targeted towards treating cystic Lyme, like cistus and teasel and grapeseed extract. And then there's, of course, antibiotics that also can work on that layer. But it's one of the reasons why we want to have a comprehensive treatment plan that deals with Lyme in its 3 morphologies, or Bartonella in its 2 morphologies, the biofilms, and things that are going to stimulate the immune recognition.
Yeah, absolutely. I think, this might be due to something most people haven't heard much about, so I'm glad we're just touching on it today. We're not going to go into extreme depth about it. I just wanted to put this out there. We are talking about infections that are masters of disguise, hence the photo right there. I want to jump ahead, if that's okay with you, Cory, and talk about immune dysfunction. So, have you ever wondered why some people seem to fight off of infection so quickly? Lucky them, while others, especially those of us with chronic Lyme, for example, stay stuck in a cycle of lingering symptoms despite the treatment. So a big part of the answer lies in how these infections actually change the way the immune system works, which is shocking to me. It weakens the body's ability to fight back effectively. So Dr. Cory, can you help us understand how infections like the 3Bs we've talked about today shift the immune response and why this immune imbalance can make it so hard to fully recover?
Yeah, so there's different aspects of this. One aspect is due to the persistence of the infection and how that infects our immune system. And the other side of that is how these organisms themselves have the ability to alter or influence the immune response as well. But ultimately, think of our immune system as divided into two sides. The part of our immunity that like eats and kills things and gets rid of things, known as our cell-mediated or innate immune system, and the part of our immune system that labels things, like points out the problem, right? And that drives a lot of inflammatory symptoms. And what we know is that when our immune systems are not capable of clearing infections, early on, we sort of see a transition towards increased adaptive immune reactivity. And specifically, we see this Th2 dominance. And Th2 simply says we produce more antibodies than we see like things like T cells that reinforce the innate immune system. And so by producing more antibodies, yes, our immune systems are pointing things out, labeling things more, but it's an ineffective immune response for clearing infections. It's simply it's kind of that person who's always like pointing out the problem, but not actually dealing with it. And so it's just your immune system yelling louder and louder, which to us feels like increased pain, increased inflammation, more symptom related issues than actually resolution related.
Wow, thank you so much for sharing that. And I think that might help highlight why, everything feels so exponentially worse. And it's not just the initial infection, it's not the battling of the biofilm barrier, but on top of everything else, as if nothing could be easy, it's immune dysfunction. All right, I'm going to get on a little soapbox here and talk a little bit about testing, if that's okay with you. So, before we get into this, let me ask you, to the audience, if you're still listening, and I appreciate your full attention, have you ever had a Lyme test come back negative? Even though the symptoms that you experienced clearly pointed to something deeper going on, or if your practitioners or your loved one, you're here advocating for them, have you seen their tests come back negative, and deep down there's got to be a problem here. So believe it or not, it's common and incredibly frustrating experience for so many people because standard tests miss the key forms of the infection. I'm going to hand this off to you, Dr. Cory, and you can walk us through why traditional Lyme testing is just falling short.
Yeah, we kind of talked about it a little earlier based on the criteria, but another big part of this is that as part of the surveillance criteria that these two-tiered studies use from standard labs like Quest or LabCorp or Peace Health or your hospital labs, they're only using what's known as the B31 strain, which is a lab strain that was created in a lab, as you might expect, and is designed to like sort of standardize testing. But as you would expect, while the world around us doesn't always follow in sync with those like lab-based rules. And so we have a lot of like what we see as wild strains, right? And testing that is going to be better is going to offer both a combination of the standard B31 strain as well as the wild strains. People often use what's known as the 297 strain of Borrelia. And then we also see an enhanced testing on a genus level, not just on the Borrelia burgdorferi, but something that like you heard Dr. Summer mentioning earlier, like something that's going to identify other species like Afzelii or Hermsii or Californicum, or there's so many types of Borrelia. And there are tick labs that will do that. Of course, we've heard of IGeneX or MDL. Armin Labs in Germany is really a wonderful lab as well that people can actually access and do testing on their own. But these are again some of the issues, and then without going further into it, the differences of immunoblots and Western blots. A lot of these better labs use recombinant proteins and things that will help to prevent false negative results, like we might have heard of from you, Taylor. where you're not meeting criteria. But if you used a lab that's actually going to be picking more specific, sections, racemers of these proteins, or doing these wild strains, you might actually get those positives. And then again, like there's the round body. You heard me talk about that. Round body is the persister cell form of Borrelia. There is one lab, Armin Labs, that can actually do round body antibodies. So you can actually get a sense of whether you have cystic Lyme or persister cells. And then, yeah, the better testing. So things that are going to cover everything, right? Like, and yes, you can have Borrelia, or you can have Babesia and Bartonella without Borrelia. Like, it does happen. It's always this idea that if you don't have Lyme, you couldn't have the other two, but that's just not true. So again, better testing ultimately is going to be more inclusive. You're going to look at everything. I know Dr. Summer mentioned, for example, Vibrant. I know we all have our differences and opinions on the different labs, but some of these will just test everything. Armin does a good job. IGenix does a good job on that. So that helps. And then when we look at the two types of responses from standard indirect tests, IgM and IgG, IgM is more associated with a current ongoing infection. IgG is a little more complicated because it could indicate you still have a chronic infection, that you have immune recognition, but it also may indicate successful treatment. A lot of times when we have serologies, we look for what's known as IgM to IgG conversion, the idea that a positive IgM is now positive IgG. And that would be a good outcome for a person with treatment, because your immune system is showing that it's adept at identifying the organism. Doesn't mean it's cleared though. So then, of course, the next step is to use better testing, like direct studies, like T-Labs, like you heard. And ELISpot is one of my all-time favorites because of the affordability of that test. And it's a T-cell based study. Your T-cells last about 60 days. So when we see gamma interferon production, we know you still have infection in those prior 60 days. So it's a nice way to track treatment. And again, relative to the cost of some of these molecular diagnostic studies, it's way more inexpensive. Or way more affordable. And then, of course, clinical correlation, can't emphasize that enough. Like, looking at even like like what we gave you guys as a questionnaire earlier, like running through that, like, are these things better? How much better? Are they still there? Like, the clinical symptoms are huge, because if you still are getting improvement with treatment, then probably you're still dealing with something, right? It's when you reach a point where you're not getting ongoing improvement after, say, 30 or 60 days, like things aren't getting better, and you've reached the point of like your clinical improvement is stable. That's a good point to sort of say, maybe I'll step away.
Absolutely. Yeah, and you bring up the point of tracking your symptoms, and that's something that, touched on before in previous master classes. The survey that you just referenced here, the Lyme load decoder. So this was like the pre-work activity. If any of you were able to do that before hopping on the master class or at some point during, go ahead and take that out now. We'll drop the link later in tomorrow's replay email reminder in case you want to try this on your own. But the idea is it's a quick survey, 10 questions asking you about symptomatology. It points you very generically to a potential treatment protocol based on those symptoms. And our hope here at Zenmen and with you, Dr. Cory, is to just guide people to start making health decisions that feel aligned to what they're experiencing, and being able to take that to their healthcare provider with something that backs it up. So something that's written and tangible. So let's move forward just a little bit, talk about some of the protocols that we have. So just a bird's eye view before I hand it off to Dr. Cory. We have 4 main types of protocols. We're going to talk about each one and how they're uniquely tailored for your individual case. So take a listen and just see, based on the protocol guide that was given to you after the pre-work activity, which one fits you. So Dr. Cory, can you share the importance of prevention? So we've talked about chronic Lyme a lot, but we haven't talked enough about prevention, and that the fact that that's a thing, especially this time of year in the summer months when we're enjoying the outdoors.
Yeah, absolutely. And you heard especially Dr. Summer really highlighting when her case studies, the different herbs that are used. So I know we're going to talk a little bit about this, and to move things along, you guys will get these protocols so you can read this on your own. But the tick immune support is such an incredible formula because it virtually includes all of the things that you've heard about at this incredible price point for a product that, you know, I didn't enter into sponsoring lightly because it is GMP certified. It doesn't have the fillers that you normally see. It is third-party tested. We're talking about a really high-quality formula. And it really is effective in these tick prevention scenarios because if you have these herbs on board for when you may have an initial transmission, that is your best case scenario for actually preventing an infection from taking hold. So in this formula, you're going to be taking, or in this protocol, you're going to be taking 2 to 3 of these capsules twice daily with food and water, and generally starting the day before you're going to make a camping trip or going outdoors into some concerning area. And you want to continue taking it through the duration of that visit. Of course, if you've spent time in some high-risk outdoor areas and you may have any concerns, you could even go up to 3 capsules twice a day to try and add some more preventative measure to it. But it's a really good all-in-one product and something that, you know, I think is an essential part of everyone's cupboard for when they plan to go out.
Well, most people don't think about the fact that they can preempt it. I mean, I know one of our previous customers has left a great review. So he works in landscaping. So naturally, he's in the weeds. And so he takes it preventively so he doesn't have to deal with the nasty effects of Lyme disease and all of its co-infections. And there's no harm in taking it preventively. It's an herbal ingredients. So for those of you who might be thinking ahead, you don't struggle with Lyme personally, but you spend time outdoors or you just want to be prepared, this is really a good fit for you. Because you are our honored guest for the masterclass, we want to thank our audience by giving them a special 20% off that's exclusive just to those who have registered for the masterclass. You can simply use the code, it's easy peasy, MC20 during checkout. You get 20% off this protocol, any of the protocols we're talking about today, a single product if you want to just try one bottle of something, or a subscription. So you can get 20% off the first month of a subscription. So take advantage of it if this is something that feels right to you. Let's move on to the next one. You get bitten by a tick. You just know you did. And now what do you do? Instead of panic, tell us what we can do, Dr. Cory.
Yeah, so this protocol just expands on the prevention protocol by increasing the antimicrobial coverage so that we're trying to ensure that in a scenario where there's a higher likelihood of some infection having been transmitted through that known tick bite, we're enhancing the outcomes by addressing you know, Babesia, Bartonella, especially more inclusively, and increasing the effectiveness against Lyme. So in this protocol, we see the addition of garlic bulb extract. You heard a lot of, like, you know, Dr. Summer talking about garlic. It's something we use, garlic extract as well, and green black walnut hull extract, because these are things that really do enhance the outcome. And in this scenario, you're going to see the doses going a little bit higher of the tick immune complex because we're trying to achieve levels in the body that are going to have more sort of pharmaceutically appropriate outcomes. And I say pharmaceutically appropriate because herbs are ultimately medications. And they require the appropriate dose to get, you know, an outcome that you want. So you'll see that in these cases, we're going to increase the protocol up to 3 capsules 3 times a day of the tick immune support. This is a 4-week protocol. So even though it is a lot of capsules, it's like the horizon's in sight. You're not doing this for long periods of time, but you can ultimately save yourself a lot of money and potential suffering by doing this because it can actually clear infections before they're able to take hold, create biofilms, move into intracellular states, and things that complicate treatment.
Yeah, thank you so much for sharing. The next protocol, we call it the symptom trial pre-testing protocol. When I first saw this, I was totally confused. What is it for? Why would this be important for somebody?
Yeah, so this is sort of 2 overlapping reasons. One is a way to, like, use a protocol to see if you actually may benefit or if you actually get a Herx response. You heard me talk earlier about the immune system flaring as you increase the antigenic load, the number of dead pieces of things floating in your body, as a clue that this may actually benefit you, or you may want to either do testing or continue treatment. So in this protocol, you're going to see the foundation of tick immune support, but you're going to see monolaurin complex being added to this, especially to deal with biofilms, right? So we have biofilm therapy in the tick immune support in the form of serrapeptase, especially, which is a great fibrinolytic enzyme, but monolaurin adds enormously to that effect. And so breaking the biofilms down allows for better treatment effect of the herbs in there, but also increase movement of organisms into the body and increased antigenic load to create that response that you'll see as an inflammatory reaction. But that same inflammatory flare or Herxheimer reaction, the die-off experience that you get, is also something you can take to your advantage to improve testing outcomes. We've heard from other people say that you don't meet CDC guidelines, things like that. When you do this protocol for a month or so before you're going to test, it will increase the immune reactivity, just as we talked about for the trial. And that immune reactivity translates to improved outcomes in indirect or antibody or T cell testing. So it can make your testing outcomes better.
Excellent.
Hopefully
Thank
I
you for
explained
sharing.
that well.
Yeah, no, absolutely. And so before we move on, just don't forget that this is 20% off, and I know we have some practitioners here. So we do offer affiliate and wholesale relationships with those who are practitioners who serve clients and patients in this field. So grab your sample, and if we wanted to talk about these opportunities to partner together for those practitioners here, feel free to hit us up after, and we can offer you some exclusive extra discounts to make it more reasonable. The last protocol is the heavy duty one, and I think it really touches on the gamut of all the symptoms we talked about today. Can you go into more detail about the tick-borne symptom relief protocol for any of us here who are struggling with chronic Lyme?
Yeah, so this is just like what we talked about with the known tick bite protocol, with just the addition of the monolaurin complex. So it's all of the flagship products for the treatment of tick-borne illness from Zenmen, designed to break biofilms, designed to create a comprehensive and inclusive protocol that's going to address Babesia, Bartonella, and Borrelia. And as we talked about way earlier in this discussion, you see those other co-infections, Rickettsia, Anaplasma, Mycoplasma. I promise those treatments are all going to be, if those infections are present, they're all going to be treated with this protocol as well. If you get into the literature, you'll see these herbs, the complex of herbs is very directed at this sort of polymicrobial aspect of tick-borne illness.
Okay, and I'm not sure if you wanted to dive more into this one. The next slide is talking about the supplements and sort of the guide through the herbals, but this is just sort of gives an overview of the protocol itself. For those who took the pre-work activity in the survey and this came up as your protocol, you'll notice, or any of the protocols actually, you'll notice there is a weekly checklist, and it tells you, it guides you. So work with your healthcare professional, obviously, get the best advice from the person who knows you and your whole symptom history. But the protocol guide that we're offering today gives a weekly breakdown, a daily breakdown of potential dosing. And so this is just sort of a summary of that here.
Yeah, and I think it speaks
Go
for
ahead.
itself. I mean, we could go into it, but this is a great graphic for sure.
This
You
is,
could
catch it in the replay or download the protocol guide for yourself, and you'll see the different layout for it. So tick immune support has got a lot of ingredients in it, and I don't want to spend too much time on it, but I want our audience to walk away to understand that every product that we have on our Zenmen Health line has been carefully selected by you, and it's crafted to deliver this clinically relevant potency. Needless to say, our products are third-party tested to ensure quality and purity. They're also made in the US. They're completely non-GMO, gluten-free, dairy-free, vegan, so they're safe even for sensitive users. Dr. Cory, can we walk through some of these and get exactly how it supports the protocol and why the dosing and the formulation matters.
Yeah, I again, like if you look at it, and I think there's a graphic explaining all the different products in the tick immune support. Maybe we just want to move to that right now.
Oh, sure.
Um,
Yeah, and
because
I'm keeping an eye
yeah,
on the QA before I move forward because I know that we have a section for questions, but if you have them now, just start pouring in. We'll keep an eye on it, and if we can answer it organically, we will do our best. But I know there was a question about black walnut, and we can talk about that in just a minute. But this is the tick immune support with the key ingredients. There's 2 slides about it if you want to just give us a quick summary.
yeah, so as I mentioned before, the tick immune complex is something that was chosen for its recognized and evidence-based approach to the treatment of all these infections and the overlap of it. It's a really perfect synergy. And these are things a lot of you, even just through Google searches or now AI, probably have read and heard about. Japanese knotweed is a very, very, very effective herb, something that we'll even augment treatment with, and something, again, we may even talk with Alice about here in her Q&A to improve outcomes. But it's it's great at reducing neurovascular inflammation. It is known to be antimicrobial for both Borrelia, spirochetes, as well as Bartonella. Cat's claw is probably one of the oldest and most historically used herbs in the treatment of Lyme. We know that it really helps to shift that immune dysfunction that you see, as we talked about, towards increasing cell-mediated immunity, supporting like intracellular natural killer cells known as CD57 cells, and reducing inflammation. Chinese skullcap, again, incredibly effective for neuroinflammation especially, but its overlapping role, just like Japanese knotweed as an antimicrobial agent for Borrelia and Bartonella, well validated now. Great publications on this, very, very effective, very safe, and something that, especially for those people who are dealing with those neurologic symptoms like headaches or mental, symptoms, it can really help to reduce that inflammation. Wormwood, again, it's like such a flagship product. We always think of wormwood because of its anti-parasitic effects and its potent recognition for the treatment of Babesia. And we see that, going all the way back into malaria therapies. But it also has shown to have incredible benefit against spirochetal and cystic forms of Borrelia. And it can inhibit biofilm formation and reduce inflammation associated with die-off. So it's an incredibly useful herb, and in these cases, something you can use it at higher doses without any concern. Cryptolepsis. Again, this first page of lists, these are all just like superstar herbs for the treatment of tick-borne illness. Cryptolepsis, again, one of these incredibly recognized herbs, especially emerging in the last 5 years. We knew about it from Stephen Buhner's work from years ago, but the validation is now there, showing that it has antimicrobial properties against that persister or stationary form of Borrelia that's so hard to treat, and also has overlapping effects for Bartonella and Babesia. That combination of cryptolepsis and wormwood is just key and amazing for Babesia. And when we bring in Alchornea, which I think is going to be on this next slide, we even see better outcomes.
Yeah,
So
moving to the next slide.
there
There
it
you
is,
go.
Alchornea. So
Yeah.
yeah, Alchornea, again, really neat, interesting data comparing even effectiveness with clindamycin and quinine and showing superior outcomes for Babesia. It's a great herb. It also has a lot of anti-inflammatory effects. And just like we talked about with cat's claw's ability to shift the immune response towards a more effective and less inflammatory one, we see that happening with Alchornea, with restoration of I love this word, immunocompetence, the idea that your immune system is more capable, it's not as suppressed. Cistus is an herb that, again, I learned about 20 maybe years ago from Dr. Klinghardt. Really neat herb that we know treats cystic Lyme. I love using cistus. You can use it. You can begin to use it with teasel even separately, but that's another discussion. But it addresses cystic Lyme, has this broad antimicrobial support. It's a great synergizer for all of these other herbs and has some antiviral effects. You heard us talk a little bit about serrapeptase. Serrapeptase is a fibrinolytic agent. It breaks down biofilms. It has or I should say microvascular anti-inflammatory effects, so very good for the blood flow, but breaks that fibrin down, and that can be hugely effective as another component of biofilm therapy along with the lauricidin. Black pepper extract, again, well known to just improve absorption. You're talking about all these herbs. How much can you absorb? You take black pepper extract, you're going to see, multifold increases in absorbability. And then sarsaparilla, another Buhner herb that really has gained a lot of good recognition for its ability to help clear that bacterial debris that drives the die-off reaction. It clears endotoxin, reduces inflammation, and improves the bioavailability of some of these other herbs. So this sort of concept of synergism. So if you haven't gathered, like you can tell, I'm pretty enthusiastic about this product.
We've gathered, we've gathered. We appreciate you, Dr. Cory. Now, normally I would go to the Monolaurin complex, but we do have Ellis that had a specific question about the walnut. She says that she can't tolerate black walnut. Can she just leave it out? So let's talk about the green black walnut extract a little bit, and maybe you can answer her question.
Yeah, so it depends on how black walnut is being used, right? So if we're thinking of it to, augment like anti-parasitic therapy, we might be talking about something totally different than if we're trying to improve outcomes for the treatment of, like, say, Bartonella and Borrelia. If we're trying to do the Borrelia Bartonella piece, a lot of times I would just suggest potentially trying to add additional Japanese knotweed. You can add, anywhere from, say, 1,500 to 3,000 milligrams of additional Japanese knotweed in a day. Or if it's really feeling Bartonella specific, you heard, again, Dr. Summer bring up the herb Houttenia. Houttenia itself can be purchased separately but has some very, very targeted anti-Bartonella effects that can improve things. And I would personally suggest that using the additional Japanese knotweed, it's something I do really commonly because, again, it's anti-inflammatory and it covers broadly Borrelia and Bartonella. So,
And the green black walnut, that would be useful in what scenario?
yeah, so like you heard, it treats Borrelia, it treats Bartonella, it treats the persister form, it breaks down biofilms, it reduces inflammation. It has this sort of like ancillary component to it where we see its ability to address like opportunistic agents as well, like fungal overgrowth we see from Candida, potentially from like spore exposure from toxic molds like Aspergillus or penicillin that could potentially, or Fusarium, things that could potentially colonize us. We have, an effectiveness at treating that. Black walnut has this rich history as an anti-parasitic agent for the treatment of intestinal microbes, worms, amoebas, filaria. Filaria are like elephantitis, like you see in some areas of the world, but in the United States, there is some evidence that ticks, especially there was a study in New England showing that up to 30% of ticks may have microfilaria, these little tiny worms that actually congest our lymphatics. And one of the big topics is they can also harbor Lyme. So now you're talking about an organism within an organism. So the use of black walnut may actually improve outcomes by addressing sort of these other potential things as a way to improve treatment outcomes, address possible GI-related microbes that are impacting our immune system, and ultimately improve overall therapy. So it's black walnut's just gained so much attention and recognition for its benefits.
Yeah, absolutely. And I hope, Alice, that answered your question. For everyone else out there, or Alice as well, continue to bring in more questions if you have them. We can, again, answer them as we continue along, and we'll save them for the end because we value so much your time. We want to make sure you walk away with a lot of meaningful content. I'm going to go back to Monolaurin complex as if the order matters. It doesn't. So tell us more about this herbal, what it does, and how it's beneficial.
Yeah, so again, monolaurin complex just is, I think of it as essential to any chronic protocol, because it breaks biofilms.
Mhm.
And it does it differently, right? It breaks that alginate layer, that sort of slime layer down. And that same effectiveness in biofilms is what also lends some of its antimicrobial effects, because cell membranes, for these organisms, these bacteria, they're phospholipids. They have a lipid soluble element to it. And so monolaurin is very disruptive to that membrane, and can actually either lead to destruction or increase the susceptibility or the penetration of some of these other antimicrobial herbs through that membrane to kill these organisms. Monolaurin is great at supporting the immune system. It's a natural, substance that comes from coconut, so extremely safe. And some of its most well-recognized research is as an antiviral agent. We've seen it in use of Epstein-Barr, herpes 6, cytomegalovirus. Some people are even using it in long COVID, because of its neutral. It doesn't have a charged component to it. It's almost like a detergent in some ways, like you would expect to break that biofilm. But that's also what may lead it to being able to sort of theoretically remove spike protein and other, which is also considered a neutral toxin in the body, to help people with long COVID.
Mhm.
And then, of course, as you might expect, it can work with the biome in the gut, because you can create biofilms in your GI tract from dysbiosis, things like that. Breaks that down, helps to address dysbiosis, restore gut health. So monolaurin's a really, really neat product.
Absolutely. Talk a little bit more about the garlic bulb extract for us.
Yes, so many people know about garlic. I mean, I think everyone's growing up with their grandma telling them to, garlic is like this magical cure. And it turns out that
Yeah.
she was right. Right. And it's easy to kind of dismiss as a culinary herb, just like oregano and other things, but it's potently effective, especially when used with intention and done regularly, right? Because allicin, the active ingredient in garlic, is very known to address, persister forms of Lyme. It's also effective against Babesia, greatly adds to the protocol in those Babesia scenarios. And it improves antibiotic or antimicrobial effectiveness. It can reduce persister bacteria, and then it's antiviral, antifungal, and helps the body to detox. We know that the sulfur compounds in there will increase phase 1 liver detox, which is our body's way of clearing things through glutathione production, as well as help with connective tissue support, which, if we think of MSM, glucosamine, chondroitin, these are all very reliant on these sulfation pathways. So garlic has a lot of overlapping benefit, both in health restoration and disease treatment.
Yeah, absolutely. It's a handy one to have around. You had mentioned briefly Japanese knotweed, so I wanted to just pop this one in. It's not part of the protocols, but it's a nice supplement to have. Do you want to talk a little bit about its benefits?
Yeah, so Japanese knotweed is more than just resveratrol. Everyone thinks of Japanese knotweed for its resveratrol content, and the resveratrol for sure is hugely helpful for, cardiovascular support, especially vessel integrity, supporting that and reducing oxidative stress, things that you'll see from Bartonella infections that live right at that layer, right? And increasing microcirculation. But it also has rutin in it, and importantly, it has a product called amodin, which is, one of the main antimicrobial aspects of why Japanese knotweed is known to fight Lyme and these co-infections. The amodin is incredibly effective. And we know that, you can increase doses of Japanese knotweed safely. If you're gonna go above say 3,000 to 4,000 milligrams a day, there may be reason to have some monitoring of a metabolic panel to ensure there's no stress on the liver. Generally, I don't see that at doses under 6,000 milligrams, so that, which would be considered very high, 4 to 6,000 milligrams. But it can really improve outcomes in treatment, offer an incredible inflammatory effect as well for the brain and the nerves and the cardiovascular system. So a lot of times, when we're moving through treatments with people, a very simple addition and very inexpensive addition can be just add 2 more capsules of Japanese knotweed, see if you get better effectiveness. So
Okay, great, good to know. All right, so I'm going to jump a bit to the pediatric treatment, the tinctures that we offer. We had our guest mention that she is here representing her child or a family member who's much younger. Unfortunately, she had to hop off, but I'm hoping she'll catch the replay and you can speak to her and other audience members who are interested in understanding what we can do to support children. So before we dive into the content of this, let me just take a moment and thank Dr. Summer for sharing her expertise today. Many doctors do tend to avoid pediatric treatment for cases as severe as the ones these children have experienced on their path to healing. So thank you, Dr. Summer, for being so brave and persistent and just supporting the little ones of the world who are fighting some horrific diseases and illnesses. So Dr. Cory has curated a pediatric lineup of protocols. We want to talk more about the specifics if you're considering bringing this up with your child's healthcare provider.
Sure. Like, one thing I always want to emphasize with these tinctures that I really appreciate is the low alcohol content. Everyone looks at tinctures as being in that 40 to 60% alcohol content, and you look at these protocols with your little ones and you're like, wow, I'm not comfortable giving them that much alcohol. This is 10% alcohol. So we're talking like really, again, well-designed, well thought out, curated products that avoid this concern for your kids and also avoid the alcohol intolerance issues you often see with chronic Lyme patients. So that's an endorsement first off. The second one is, these protocols, just as you heard from the Tick Immune, it's just designed to be as inclusive as possible. I think Dr. Summer will echo, like, children are in some ways, there's this stigma, like they're more frightening to treat because of liability and all these other things. But on some other level, because of this sort of volume to surface area difference that we see with humans, adults, like they're easier to treat. And like the outcomes sometimes are more rapid when you begin treatment. And so tinctures are a great way to work. And, we kind of went through what all of these do, but these are all designed for kids between 30 and 100 pounds, where we're using 1 dropper full per dose. If you're looking at under 30 pounds, you see Clark's rule there as a way to figure dosing out. But I think Dr. Summer would echo that it's always appropriate, especially in children that small, to work with a provider.
Mm-hmm. Yeah. Dr. Summer, did you want to add anything else in just your experience or with the products that we're offering, to finding a through line of how we can empower parents to feel like they're not lost in the system, that they do have the ability to find a solution for their children?
Right. Just so the rule of thumb is just to move in a very low and slow manner, comprehensively, and work through the data. So, and understand that healing is never linear, that there are going to be some bumps in the road, and that doesn't always mean that, you're regressing back or you're not getting better. And Dr. Cory mentioned that with the biofilms, and there's so many facets and components to treating these illnesses, and those case studies were some of the worst that I've had, just to say, here's, let's shine some light on some really intense cases, just to give you a sense of other things that can also be a burden and other things that have to be dealt with. So it's a marathon. Take a deep breath and work through the symptoms.
Yeah, well spoken. I mean, chronic illness, whether you're small or you're an adult, it's an uphill battle, and we appreciate both of you being on this call for so long and just sharing your expertise. It was immensely insightful, and I hope our audience feels empowered and informed today. I know we have so much more that we could cover. Dr. Cory, is there anything else that we haven't hit on that you would like to address, or do we want to move into the Q&A section and wrap up for the day?
I think after 2 hours and 15 minutes, probably everyone's ready to move into Q&A. I could go, and we could talk about all kinds of things. I mean, right, there's so many
Always.
associated aspects of chronic Lyme from, but no,
Yeah.
let's.
The good news is that we over prepared, and so we have content for the next masterclass. So if you're listening in or catching the replay and you're caught and you want to catch more, then stay tuned. We have more masterclasses coming up in these series. Give us a break. We're going to have a little bit of a summer vacation coming up soon, and then we'll regroup and we'll reach out to you all via email. But all that to say is that this has been invaluable information, and we hope that you feel like you've learned something or a few new things, and you feel like you have the next steps in your hands. So one of the biggest benefits of joining a live masterclass with expert Lyme literate doctors like Dr. Cory and Dr. Summer is that we do get a live Q&A session. So as we're transitioning to that part of the time together, thank you everybody for being here. A big thank you to Dr. Cory and Dr. Summer for devoting time to putting this masterclass together, showing up to share insights with all of us. And for our audience, if you can take a moment, I'd love your feedback on today's session. So feel free to pop in the chat any questions that you might have, any big takeaways that you feel like, wow, that's something that we need to talk more about in our society, anything that surprised you, or if there's something that you want us to clarify, or potentially what is something that would be interest of you for a future masterclass. This sort of feedback is incredibly important and your words matter. So if you have questions or if you have any feedback, go ahead and pop that in the chat now. And as we do that, we'll just wrap up and yeah, we'll hand it off to Dr. Cory and Dr. Summer.
Yeah, is there a specific order to treat Lyme? Do you want to field this one, Summer?
Sure, why not? So mentioned in some of the previous case studies, typically the body will tell you what the biggest burden is at the time. So if you're presented with Lyme and Bartonella and Babesia and all of these different things, you want to target the one where you're most symptomatic. And then again, a lot of these herbs have a lot of interplay with other co-infections. So I would target whatever appears to be, top of mind for your immune system, and then start secondarily adding other components to treatment as you tolerate it. So I think that, Cory, I don't know if you have any other insights with that one.
I would say the exact same thing. I always think of Herring's Law, right? This idea that, like what you're saying, everything presents in, the most important way from, the top down, and it, like, your symptoms guide you. So ultimately, I'm a big believer in trying to treat as many things as possible at once. I tell my patients all the time, I'm not patient. Pun intended. I just want people to get well as quickly as possible. So I'm not someone who's like, we'll treat Babesia and then we'll treat Bartonella and then we'll treat Lyme. Like, there's emphasis given for sure on their dominant presentation. And if you show like, wow, you've got all these Babesia symptoms, then it might be worth like layering more attention onto it, as Dr. Summers said. But ultimately, if there's suspicion that there's more going on there, like there likely is, try and do as many things as possible. And that's where like this comprehensive protocol is used. And then again, if, the decision is I want to add additional garlic or, go a little bit higher on that, we want to add some more black walnut, we want to try and fortify, Artemisia pulses. Like, there's all kinds of things you can do to try and put more attention onto that individual organism, or bridge into pharmaceuticals. But I think, yeah, let symptoms guide you.
Mm-hmm. Absolutely. Any other questions while we are wrapping up now or never? Well, till the next masterclass, I should say. Thank you, Dr. Vale. We appreciate you.
What? Okay, so Dr. Val, yeah. So what pearls can we offer for treating connective tissue breakdown? So again, that goes into the two sides to this. One is like, okay, well, what's causing the connective tissue breakdown? Is it because there's Lyme? So are you going to want to try and put more attention onto removing the cause of that problem? Or is this a person with like, connective tissue hypermobility, Ehlers-Danlos, something like that, where reducing collagenase activity, the enzyme, can be useful with something like horse chestnut extract can reduce that. On the other side of that coin is what can you do to increase connective tissue integrity? So this is where those sulfation-based compounds can be helpful. You're getting into MSM, glucosamine, chondroitin, vitamin C, copper, things that help collagen deposition, right? And then you can also, if you're, if you've gotten into it, look into peptide therapies, right? So GHK copper has been very, very effective. Thymosin beta 4, useful, BPC 157. These are all really good ways to reduce connective tissue inflammation and increase collagen deposition. So those might be some thoughts. And bone marrow involvement. It depends on what you're talking about, I guess, for bone marrow involvement. Babesia, I often say, can get into the reticulocytes. So there's like immature red cells, and that it can be an important part of targeting things. At one point, red root was used as an herb to more highlight or drive more treatment effectiveness into the bone marrow. So you could look into doing something like that. I don't know. Those are some thoughts I would have. Hyperbaric oxygen, another great way to push things into the bone marrow as well. I love HBOT as well. So
Thank you
And
so
never
much.
forget viruses, because I do find there are a lot of providers who are so focused on tick-borne, you forget all the other things that could also contribute to that immunosuppression or connective tissue or bone marrow suppression with a lot of people. But and the things that Dr. Cory mentioned would also help with that. But just a thought.
for sure.
Thank you so much. Yeah, thank you for thank you for your good question. Any others? All right. Well, we don't need to sit in silence. So let's just say thank you once more. Again, your time is invaluable. We so appreciate you, Dr. Cory and Dr. Summer. It means so much that you were able to take time out of your day and share all of this invaluable information. And to our audience, thank you for hanging on with us and hanging out for, I'm not even going to say how long we've been online, but you've just been troopers. So I'm going to pop in the chat here the link to check out the protocols, really dive in, explore it, read it for yourself. That link as well will be where we have the masterclass replay. So if you just click on that and hang on to it, I know we all like to collect tabs on the internet browser. So keep that tab open. Within the next 24 hours, we'll have the replay up there, and you can go ahead and watch the key moments or the moments you wanted to revisit. So thank you so much as we wrap up, Dr. Cory and Dr. Summer. And we hope you all have a wonderful day ahead. Thank you all. Thank you.
Thanks.
Take good care. Thank you.